and welcome to Dr. Dad Talk Show. I'm your host Indubala, and today we have invited a very special guest with us, Dr. Sandeep Talwar. Welcome to our show, ma'am.
Thank you.
Ma'am, please tell me about yourself.
Well, I am Dr. Sandeep Talwar, and I have been practicing IVF actively from 1995 onwards. So it's been a long journey.
Yeah. Okay, ma'am. Ma'am, as we say, we have received many questions from audience. So move to the questionnaire.
Yes.
Okay. It's talking about egg freezing. Are there facilities that help in the process? If so, can you tell us little bit about the procedure and what like the tentative cost for the same?
Well, egg freezing is very much possible. It is a part of IVF. Only what we are not doing is that we are not making embryos or we are not fertilizing the eggs. So we stimulate the ovaries, we aspirate out the follicles from the ovaries, and those in that follicular fluid we identify how many eggs or oocytes there are, and those oocytes are then frozen in liquid nitrogen. So very much it is possible, and it is in today's scenario it is very much possible.
Okay, move to next one. Can you also tell me who should be the people who should think about getting eggs frozen?
Well, there are two scenarios that you are delaying your age of marriage due to some reason, you are unable to find the right partner for you. So you just want that eggs should be frozen so that age does not go to that extent that the quality and the number of eggs go down. So women, if they are approaching 35 years of age, they should start considering egg freezing, especially if the marriage is not on the cards at near future. Or egg freezing is even done in patients with breast cancer and other, so that is another thing where you preserve eggs. But what we are talking today is social egg freezing, or when you are delaying your age time of marriage and you want your fertility to be preserved.
Okay. Ma'am, can you please tell me, please give us 5 tips to conceive naturally.
Well, first tip I would say is have a healthy lifestyle.
Okay.
Exercise. Number 2, eating right.
Okay.
That is a very, very important thing. Eat right food. Now, what are right foods? Eat high proteins. Eat protein-rich foods, but less in fats and less in carbohydrates. Number 3, de-stress yourself. Don't stress too much. Number 4 is that you should start, knowing that what is your fertility potential. And number 5 is do those tests which tell you your fertility potential, like your hormone and your partner's semen. So just do that, and that should take care of majority of things.
Ma'am, as you say, like de-stress. मैम ये तो बहुत ही मुश्किल है आजकल के लाइफस्टाइल में, क्योंकि एक तो वैसे ही न्यूक्लियर फैमिलीज हैं, और अगर कोई जल्दी से लाइक चाहता है कि लाइक एक ये खुशी जो आप देते हैं उन्हें, जो लोग नहीं कंसीव कर पाते हैं, तो मैम उनके लिए लाइक डिस्ट्रेस होना तो बहुत ही ज़्यादा मुश्किल वाला काम है. तो उसके लिए आप क्या टिप्स देना चाहेंगे मैम?
आप अगर डी स्ट्रेस नहीं कर सकते तो आप काउंसलिंग ले लीजिए, उसमें तो कोई बुरी बात नहीं. और आज की सोसाइटी में तो इसको कोई खराब नज़र से देखा भी नहीं जाता.
राइट.
सो गो एंड टेक प्रोफेशनल हेल्प. अगर आपको लग रहा है कि आपसे खुद से ये चीज़ नहीं हो रही, तो फिर seek professional help and then do it. But please do it.
Okay.
Do yoga, do pranayam, even that helps.
Right, ma'am. Move to next one. Considering the general age of women has shifted to their late 20s or early 30s when they want to become mothers, does this affect in fertility? If so, what can be done in this regard?
Well, it has shifted from mid 20s or early 20s, when we people got married, to late 20s, early 30s or mid 30s. So it does matter. A woman's age is very, very much related to your fertility potential. And as the age goes higher, the number of eggs and the quality of eggs declines. So you are born with a certain basket of eggs when you are born. And as the period starts or menarche starts, that bucket or that basket is going to get slowly depleted. So hence the age is very, very important, and it is related. Female age and fertility are very closely related. And what we can do is we can preserve our fertility by doing egg preservation.
Ma'am, IVF, we hear this a lot now. What are some most important reasons why people are facing fertility issues these days?
Well, one most important thing which I said was that people are not considering to have child in early stage. Even if they get married early, they are not wanting to consider having a kid at that age.
Right.
Probably the goals which people have set or the lifestyle which they are leading is not conducive to having children, so they keep on postponing that thing. And once you postpone that thing, then to have a child becomes more difficult, because female age is also becoming higher.
That's right.
So that is the most important factor which is leading. And semen quality and semen count is going down. So it is not only the woman, but it is a man also. We are seeing lot of patients who are coming with decreased semen number, semen count, semen quality. So even that is getting affected.
Okay, I mean, what is the right age? Like कब तक सोच सकते हैं बेबीज के बारे में? वैसे तो IVF ने काफ़ी इजी कर दिया है बियॉन्ड एज, लाइक फिर भी मैम इतना किस टाइम तक लाइक हम सोच सकते हैं कि एवरीथिंग विल बी ओके, देन वी कैन डू दिस प्रोसीजर?
Well, that age will be different for different people, but 35 पे एकदम से आपकी fertility गिरती है.
Okay.
फिर 38 पे दोबारा से बहुत decline आता है, और 40 के बाद there is a definite very serious decline. So you should keep these numbers in mind when you are considering.
Right, ma'am. Move to next one. IVF is a costly affair and the success rate also varies. If you can shed some light on both, like what's the average cost and different scenario of success?
Well, the cost is not that much what we people think it is. It would be anything, say, between 1.5 to 3 lakhs, depending on what is it that you require.
Okay.
What is the procedure which is required for you? Advanced procedures are required, something else is required, because that is not so simple as it looks. Now the success rate or the success will depend on a lot of things. It will depend on the female age, it will depend on the male semen count and semen parameters, and any additional problems that the woman is having. Is she having PCOS? Is she having endometriosis? Does she have fibroids? Any other thing also which is there. So a detailed history, a detailed analysis is very important to predict what is a success going to be.
Okay, and it depends on the different structures also, body,
Yes.
What are their problems?
Exactly. Why has she come to you for IVF? Tubes are blocked, semen
Yeah,
is bad,
so many
her
things
eggs are not forming properly. So it all depends on that.
Okay. Who are the ideal candidate for IVFs?
Well, IVF started initially for a person who had both tubes were blocked. So it started for fallopian tube block. Then it went to other indications like eggs are not forming properly, or male problems are there, semen count is bad, semen motility is bad, endometriosis, other problems. So there are so many things that, or you don't find any reason, but she's unable to conceive, something we called as unexplained infertility, even for that.
ओके और मैम मेरा एक और आपसे सवाल है कि आपके पास बहुत सारे मैंने देखा है कि पेरेंट्स आए हुए हैं फॉर दिस IVF ट्रीटमेंट, तो मैम आप कैसा महसूस होता होगा आपको, लाइक जब उनकी अब खिले हुए चेहरे लाइक देखते हैं, आपको पता चलता है कि सक्सेसफुल जो वो सोच सकते थे कि मतलब हर तरफ से कि ऐसा नहीं हो सकता या लाइक हम लोग कभी पेरेंट बन पाएंगे भी या नहीं, और आपके पास आके उनको ये एक खुशी जो मिलती है, कैसा महसूस करते हैं आप?
बहुत अच्छा लगता है। सक्सेस किसको नहीं अच्छा लगता, और अगर आप किसी को खुशी दे सको तो इससे बड़ी तो कोई चीज़ ही नहीं है। हमारे प्रोफेशन में सबसे बड़ी खुशी यही है कि आप किसी को, अगर आप किसी को लाइव बच्चा दे सकते हो, और वो भी वो वाला कपल जो इतने साल से ट्राई कर रहा है, तो ये बहुत एक अलग तरह की खुशी महसूस होती है।
और पेरेंट्स भी बहुत खुश हो जाते हैं।
बिल्कुल, ये बहुत एक ग्रेटिफाइंग और बहुत सेटिस्फाइंग फीलिंग होती है।
यस मैम। ओके, एनी टेक अवे मैसेज मैम फॉर आवर ऑडियंस?
मेरा टेक अवे मैसेज यही है कि डोंट गेट डिसहार्टन्ड। इफ़ यू डोंट सक्सीड इन वन अटेम्प्ट, डोंट फील कि अब कुछ नहीं हो सकता या अब हमारे साथ कुछ नहीं होगा। ये फीलिंग कभी आप मत आने दीजिए। प्लीज़ ट्राई अगेन, प्लीज़ कंसल्ट योर डॉक्टर, please try and take help and don't get disheartened. That is my take home message.
Thank you so much ma'am for being with us.
Thank you. Thank you so much.
Thank you viewers for joining us. I hope today's discussions will be very useful and informative. If you have any other questions, kindly ask us. And till then, bye bye, take care, and please keep watching Dr. Dan Talk Show.